Elevated hematocrit and platelet counts can be indicative of underlying disorders, ranging from benign physiological adaptations to serious pathological conditions. Understanding these abnormalities and their associated diseases is crucial for timely diagnosis and management. Diseases associated with elevated hematocrit and platelets. Polycythemia vera, a myeloproliferative disorder characterized by the overproduction of red blood cells, often accompanied by elevated platelets and white blood cells. Symptoms include headaches, dizziness, itching, particularly after a hot shower, and a risk of thrombosis. Secondary polycythemia, caused by increased erythropoietin production due to hypoxia, such as chronic obstructive pulmonary disease, sleep apnea, or high altitude or inappropriate erythropoietin secretion, such as renal tumors. Platelet counts may rise due to reactive processes. Reactive thrombocytosis, secondary to conditions like iron deficiency, anemia, inflammation, infection, malignancies, or post-splenectomy, often mild and temporary but can increase thrombotic risk. Essential thrombocythemia, another myeloproliferative neoplasm leading to persistently elevated platelets. Symptoms include microvascular complications such as erythromelalgia and thrombosis. Chronic myelogenous leukemia, a malignancy characterized by the overproduction of various blood cells, including platelets, often associated with the Philadelphia chromosome mutation. Screening and diagnostic approach. Complete blood count baseline test to evaluate hematocrit and platelet levels. High values warrant further investigation. Erythropoietin levels elevated in secondary polycythemia and low in polycythemia vera. JAK2 mutation testing common in polycythemia vera and essential thrombocythemia. Oxygen saturation and arterial blood gas. Assess hypoxia-related secondary polycythemia. Inflammatory markers. See reactive protein and erythrocyte sedimentation rate to detect underlying inflammation or infection. Bone marrow biopsy confirms myeloproliferative disorders like polycythemia vera and essential thrombocythemia. Peripheral smear helps identify abnormalities in blood cell morphology. Imaging studies, abdominal ultrasound or CT to rule out splenomegaly or tumors. Conclusion: elevated hematocrit and platelets often signal underlying diseases requiring careful evaluation. Screening starts with a thorough history, physical examination, and complete blood count. Further investigations, including genetic testing and imaging, can confirm diagnoses. Timely identification and management are crucial to reducing risks like thrombosis and ensuring better outcomes.